Hi everyone, good evening. I'm Tim Snewin and I'm the regional manager for the Southern inspection team here at the General Pharmaceutical Council. As we set standards for pharmacy professionals, the GPhC also sets standards for registered pharmacy premises. And it's the responsibility of pharmacy owners to actually meet those standards. And as students and as foundation trainees, you should really be looking at those and familiarise yourself with these standards that apply to pharmacy premises. And again, you can find these on our websites. We as the inspection team, inspect registered pharmacy premises to see if they are meeting all of these standards. And we employ a team of inspectors and clinical specialists, all of whom are pharmacists, and a small number of technicians, to provide assurance to the public that the premises are actually meeting our standards. Just see if I can move us on. Yeah. Okay, so there's various types of inspection that we conduct. I'll just run through those very quickly. We've moved, since COVID, we've moved to actually conducting a random sample. Previously, we did routine inspections on a 3-yearly basis, or 3 to 5 yearly basis. But following on from COVID, we introduced some changes. And one of those major changes is to introduce a random sample. And that's a statistically valid random sample of pharmacies taken from both geographic location, the type of pharmacy. So you're probably aware we register various types of pharmacy. And we carry out routine inspections of those. The second type is re-inspection. So we re-inspect pharmacies that have failed our standards. If a pharmacy fails our standards, we're committed to going back within 6 months to re-inspect them, to provide assurance that they are now meeting our standards, or if they're not meeting our standards, to consider what further action we should be taking. The next category are newly registered premises. So we're committed we obviously register new premises, pharmacy premises, but we're committed to actually visiting those within 3 months of opening, to again provide assurance to the public that they're meeting standards early on after they've opened. And then we've introduced a new type of visit or assurance, and that's assurance calls and visits. And we do this. It's a shorter visit or a shorter call to the pharmacy, and we're looking at core standards around the premises, and we're looking for assurance that those have been met. These aren't currently published, and we are actually looking at sampling 10% of those are re-inspected to compare what we get from the assurance calls and visits compared to the random sample. And the final group are the risk-based program of work. And this, as Jerome alluded to earlier, some of that comes from the intelligence referrals we get from the concerns team. Some of it may be actual information that comes from other stakeholders, or it may be as part of our work assisting the investigation team. So let's look at some examples of some of the things you would need to consider in order to meet our standards for pharmacy premises. And when we talk about risk, we mean managing risk to support patient safety, and the principle about having the right governance systems and processes in place to try and keep patients safe. When we are obviously aware that not all pharmacies provide the same services or operate with the same processes. So what sort of questions should you be asking yourself in relation to our inspection process? And one would be, has my pharmacy got systems and processes in place to manage risks associated with the specific services that you are providing? For example, do you keep records of near misses, errors, and incidents? And have any changes been made as to how the pharmacy operates following on from an incident or near miss? So can you demonstrate some learning from these sorts of incidents? Something that's been a bit more topical more recently is the sale of medicines subject to abuse or misuse and how you control those, and in particular some of the OTC medicines. And it's quite topical because if you keep up to date with pharmacy news, you'll know that yesterday an announcement was made that codeine linctus is moving to prescription-only medicine, and that's partly because of a lot of problems around the use and sale of codeine linctus and its misuse. So that will soon be disappearing from this list. But there are other products as well which pharmacies sell over the counter. And I just want to stress to people that, you know, if you are selling these products, or if you're not, you should be aware that these products, there are products that can be sold over the counter that can be abused. So you do need to think about when you're dealing with these sorts of requests for these products, you know, how are you actually controlling the sale of these and preventing the misuse of these products? And the products are things like cyclazine, promethazine, so it's in Phenergan, and codeine contained in some of the cocodamol and other painkillers that are out there. So, just very briefly, what happens during an inspection? So, the inspector will obviously introduce themselves, um, and to you, what pharmacy team as a whole, and explain how the inspection process will work. Um, the inspector will be looking for evidence of how the pharmacy operates, and we'll be speaking to a number of all the members of the pharmacy team to ask them questions and to observe and see what's going on in the pharmacy in that snapshot whilst they're in the pharmacy. During your foundation year, some of you may have already been present when there's been an inspection, so some of this will be familiar with you. But part of the process will be collection of evidence. So the inspector will do that by observation. So they'll be looking at things, they'll be questioning people, they'll be putting scenarios to people, and they'll be looking at documentation. So a typical example of that will be records, prescription records, controlled drug records, it may be error records and things. And we'll be discussing with the team, you know, what they're seeing and asking questions as they go along. At the end of the process, well, the actual physical inspection, which typically takes anything between 2 and 5 hours, the inspector will provide feedback to the team. So there shouldn't be any big surprises after the inspection. They won't tell you the actual outcome at the time, but there should be you should be very clear if there are things when the inspector leaves, it will be clear to you there will be some areas if you need to improve things. And they will provide you with some feedback about some areas for improvement and things. And likewise, within a few days after the inspection, a written report will be provided, and that will actually state whether you meet the standards or you don't meet the standards. It's as straightforward as that. We do also highlight good practice, and if you don't meet the standards, you may be issued with an improvement action plan, which will set down what you will set down what you're not where you're not meeting the standards, and asking for you to provide evidence of how you're going to now meet those standards going forward. And that will then be followed up with a re-inspection. In particularly serious cases where we feel that there's not enough assurance being given that we will get the improvements to protect the public, we will also consider formal enforcement action. That's statutory action, statutory powers that the GPhC have, and they're there to protect the public. And those include imposing conditions, restrictive conditions, usually on the pharmacy. And an example of that may be where we have really serious concerns about what's going on. We may impose conditions that they, for example, can't handle controlled drugs. They can't supply or dispense controlled drugs. We don't impose those conditions without careful consideration, and that's the registrar that imposes those conditions. The alternative is we have the power to issue an improvement notice as well, and that is a statutory. It's slightly different to an improvement action plan. Sounds the same, but it is slightly different, and the consequences of that are failing to comply with that with an improvement notice, which will state very clearly what you have to do to come into compliance that will result in formal action, which potentially could lead to the removal of the pharmacy from the register. So, to provide assurance to the public, we publish all our inspection reports, our normal inspection reports, and that's the website. We're in the process. We started publishing in April 2019. Our intention was to have a published report for every single pharmacy in the country, and the website. If you go onto that website, you can search by town, pharmacy name. There's various parameters you can set, and you can find the latest report for the pharmacy. And members of the public can access this to actually have a look at the services that are being provided from their pharmacies. We also have established a knowledge hub, which is there for the pharmacy team, which we utilised quite a lot during COVID to highlight good practice and, in some cases, poorer practice, to try and encourage learning across the profession. Particularly where we either encountered problems or where we saw particularly good practice and examples of good patient care. We've highlighted those on this knowledge hub. So again, if you want to have a look at that, it's accessible from the GPhC website or the inspection website.